predictions, for where the men's health space is going, your commentary on it, someone who's been in it a long time, and what you see as the challenges ahead, the things that are working, things you're excited about in terms of the space?
I think, gosh, you use the word excited. Normally I'm a glass half full person, but that sort of question leads me to feel a little bit cautious about being glass half full. Because I think the gains that we've seen in the last 20 years are pretty marginal. I think the last big breakthrough was probably some of the stuff around cardiovascular disease. So, a combination of improved sort of microsurgical techniques and things like the statins, lowering cholesterol, that sort of thing. I think there was a good result, a good gain, particularly for men, from those sort of things. But I think since that time, I don't think we've seen massive amount of gain. I think the only way that we're going to see impressive gain for men is if there's a breakthrough with cancer treatments of some sort, which are happening obviously all the time to some degree, but perhaps a more major breakthrough with the cancer stuff. The other one, which I think is less likely to happen, it's probably where my pessimism kicks in, is I think the biggest thing would be change to socioeconomic circumstances that can close the inequality gap. And I mean that at every level. So I mean it at a global level, trying to close the gap between the West, as it's often called, and a lot of continents like Africa and South America, and within country inequalities. So all of those things, try and address the things that lead to those inequalities, I think would see massive gain. But I'm not too sure that we're in a place where that's likely to happen at the moment. I do wonder if COVID might help us rethink a few things. I think we were just beginning to shift away from a neoliberal political agenda before the COVID thing. And I wonder whether that shift will be accelerated or whether COVID will drive us back in the opposite direction. And I wouldn't like to place a bet on that. But if it accelerates a move away from neoliberal economics back to sort of a welfare state system, we might see good gains again.